So today we're going to learn about a 5.5-year-old girl with very early onset schizophrenia. Our story starts out with a mother and father. Now the mom has a delay in language development and she did not finish primary school. Dad can hold no regular job, making their socioeconomic status very low. Our patient has a brother with a delay in motor language development as well. Now, our child is 5.5 years old, like I said, and that is very crucial to the diagnosis of VEOS. She had a normal pregnancy to term. There was no substance abuse, but there was a little bit of psychological stressors in her mother during pregnancy. She has a motor development delay, which means she's clumsy. She has an expressive language delay, which means she talked at a later time. I think she started talking real sentences at around 2. She was potty trained at 4, and she has no significant medical history, no brain trauma, and no seizures. Now, our child was a very normal 5.5-year-old girl. She loved playing with her toys, playing with her brother. She was very talkative, and she loved communicating with everybody to learn about them. And she loved dressing herself. But then things started to change, and she started laughing uncontrollably, crying uncontrollably. She would often stay up late talking to herself, and she started neglecting her brother. She wasn't playing with him, and her parents saw this and became very depressed, tired, and worried about her. Things started getting worse now. She would often call to her cat and be like, "Come, Cece, eat grandmother." She would also say, "Oh my goodness, there's bugs coming from your mouth." And she would point to the ground, often saying that her friend was murdered by somebody with a knife and she was in the grave. But nobody saw this, and none of this was true. So our patient started becoming very distant, no communication. She would start hitting her brother in the face. She wouldn't eat or drink. She wouldn't dress herself. She would put her hands up in the air and flail them and grab for stuff that wasn't there. She became very hyperactive, and her dad would hit her sometimes to punish her. And she would lick her palms and start cursing uncontrollably. So, like any caring parents would, they took her to a psychiatrist. Now, the psychiatrist met with her during a clinical interview, and our patient did not maintain eye contact. She didn't answer any questions. She had no facial expressions. It was just like she was just sitting there. So, according to the DSM-5, our psychiatrist diagnosed our patient with very early onset schizophrenia. Because she's under 13 years old, she qualifies for this diagnosis. The genetic factors of motor development and language delays and her paternal aunt having schizophrenia really plays a role. She has some delusions. She has hallucinations, which is the example of the cat eating the grandmother and the bugs. She has disorganized speech if she doesn't speak at all. She is hyperactive. She has disorganized motor behavior, which is hitting the brother, the aggression, the flailing of the arms. She has positive and negative symptoms. She has blunted affect, which means she's just flat in her communication. And she has algoria, which means that she cannot hold a conversation. So some treatment was done on our patient. She received an MRI, which came back normal. She underwent a sleep EEG, which also came back normal. Now, she had a normal blood test, but she did have a little bit of an iron deficiency. Play therapy started becoming a thing, but it wasn't working because she would not interact with the therapist at all. And the Clinical Global Impression Severity of Illness Scale was used in this clinical interview and treatment plan. So starting treatment at risperidone, 5 milligrams a day at bedtime, And the psychiatrist also sent her to psychoeducational programs for schizophrenia. Week 1, her sleep improved, hyperactivity improved a little bit, positive symptoms were still there, the hallucinations were still there, bizarre behaviors, the symptoms of algoria were still there, blunted affect, she wouldn't eat, her aggression continued. So week 2, there was a risperidone increase to 1 milligram a day. Week 4, we finally start seeing a little bit of progress. She starts speaking a little bit more, maintains some eye contact during that play therapy time. At week 8, risperidone is increased to 1.5 milligrams a day, and she starts having a little bit of reaction to it by developing nocturnal uresis, which is bedwetting while you sleep. 3rd month, her positive and negative symptoms improve. She starts using short sentences. She responds to stimuli. The 4th month, she begins tolerating her medicine a little bit. So it's increased to 2 milligrams a day, and this is where it's going to stay. The 5th month, we have a significant amount of improvement, and she is almost at the stage she was prior to development, or prior to diagnosis, I should say, not development. And she's achieving well in those special education classes for schizophrenia. At 1 year, it's important to note that she did not develop more psychotic episodes. Her developmental milestones still suffer a little bit, but all at different levels. Some important findings of this case are that she has a catatotic type of VEOS, which is the rarest form. And some of those symptoms that prove this are not dressing herself, the social withdrawal, loss of interest, and the psychomotor activation. The 2 milligram a day treatment of risperidone was crucial to this diagnosis and case study. And she developed a 3.5 kilogram weight gain within the first 6 months. So I hope you enjoyed my presentation and you learned a little bit more about very early onset schizophrenia. Thanks for watching.